Good afternoon, everyone. Today we are going to learn about the examining ethics in nursing research. Ethical research is essential for generating sound empirical knowledge for evidence-based practice. You need to be able to appraise the ethical aspect of published studies and of research conducted in clinical agencies critically. Most published studies include ethical information about subject selection and treatment during data collection in the methods section of the report. Institutional Review Board, called IRB in universities and clinical agencies, have been organized to examine the ethical aspect of studies before they are conducted. To provide you with a background of examining ethical aspect of studies, we are going to talk about the ethical codes and regulations that currently guide the conduct of biomedical and behavioral research. The first one is Nazi medical experiments. The program of Nazi regimen included sterilization, euthanasia, and medical experimentation for the purpose of producing a population of racially poor Germans. The medical experiments were conducted on prisoners of war and persons considered to be racially vulnerable, such as Jews, who were confined in concentration camp. The experiment involved exposing subjects to high altitudes, freezing temperatures, malaria, poisons, spot fever, or untested drugs, and performing surgical procedures. The Nazi experiments violated numerous rights of the study subject. The selection of subjects were racially based and unfair, and the subject had no choice. The mistreatment of human subjects in studies led to the development of Nuremberg Code in 1949. The code includes guidelines that should help you evaluate the consent process, protection of subject from harm, and balance in benefits and risks in a study. The Nuremberg Code provided the basis of the development of the Declaration of Helsinki, which was adopted in 1964 and revised most recently in 2008 by the World Medical Association. The Declaration of Helsinki includes the following ethical principle. First, the investigator should protect the life, health, privacy, and dignity of human subject. Second, the investigator should exercise great care to protect subject from harm in non-therapeutic research. Third, the investigator should conduct research only when the importance of the object outweigh the inherent risk and burdens to the subject. The most recent addition is that researchers must use extreme caution in studies in which participants receive a placebo treatment. You can access the 37 ethical principles of the Declaration of Helsinki in this website. The next historical event is the Tuskegee syphilis study. The U.S. Public Health Service initiated a study of syphilis in African American men in the small town of Tuskegee, Alabama, for 30 years. The purpose of this study was to determine the natural course of syphilis in African American men. Many of the subjects who consented to participate in the study were not informed about the purpose and procedure of their research. Some participants were unaware that they were subjects in a study. From the mid-1950s to the early 1970s, one researcher conducted research on hepatitis at Willowbrook, an institution for the mentally retarded in New York. The subjects were children who were deliberately infected with the hepatitis virus. During the 20-year study, Willowbrook closed its door to new inmates because of overcrowded conditions. But the research world continued to admit new inmates, and parents had to give permissions for their child to be in the study to gain admission to the institution. Another unethical study was conducted at the Jewish Chronic Disease Hospital in New York in the 1960s. The purpose of this study was to determine the patient rejection responses to live cancer cells. A suspension containing cancer cells that had been generated from human cancer tissue was injected into 22 patients. Researchers did not inform these patients that they were taking part in a study or that the injections they received were live cancer cells. This unethical study was conducted without the informed consent of the subject and without institutional review and had the potential to injure, disable, or cause the death of the human subject. In 1973, the Department of Health, Education, and Welfare, called DHEW, published its first set of regulations for the protection of human research subjects. All research involving human subjects had to undergo full institutional review, which increased the protection of human subjects. However, reviewing all studies without regard for the degree of risk involved greatly increased the time for study approval and reduced the number of studies conducted. Because of the DHEW regulations did not resolve the issue of protecting human subjects in research, the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research was formed in 1978. The Commission identified three ethical principles. The principle of respect for persons indicates that people should be treated as autonomous agents with the right to self-determination and the freedom to participate or not participate in research. The principle of beneficence encourages the research to do good and above all do not harm. The principle of justice states that human subjects should be treated fairly in terms of benefits and the risks of research. The U.S. Department of Health and Human Services and U.S. Food and Drug Administration regulations provide guidelines for the protection of subjects of the information obtained through research. With the electronic access and transfer of individuals' information, the public became concerned about the potential abuses of health information of persons in all circumstances, including research projects. Therefore, a federal regulation, the Health Insurance Portability and Accountability Act, called HIPAA, was implemented in 2003 to protect people's private health information. Let's move on to the protecting human rights. The human rights that require protection in research are the right to self-determination, privacy, anonymity and confidentiality, fair selection and treatment, and protection from discomfort and harm. The right to self-determination is based on the ethical principle of respect for persons. It indicates that humans are capable of controlling their own destiny. People should be treated as autonomous agents who have the freedom to conduct their lives as they choose without external controls. Researchers treat subjects as autonomous agents in the study when they informed them about the study, allow them to choose whether or not to participate, and allow them to withdraw from the study at any time without penalty. A subject's right to self-determination can be violated through the use of coercion, covert data collection, and deception. Coercion occurs when one person intentionally presents an overt threat of harm or an excessive reward to another to obtain compliance. The second one is covert data collection. With covert data collection, subjects are unaware that research data are being collected. The final violation is deception. The use of deception, the actual misinforming of subject for research purpose, can also violate the subject's right to self-determination. Persons have diminished autonomy when they are vulnerable and less advantaged because of legal or mental incompetence, terminal illness, or confinement to an institution. Minors, including neonates and children, pregnant women and fetuses, mentally impaired person, and unconsciousness patient are legally and or mentally unable to give informed consent. They require additional protection of their right to self-determination. For neonates, it's also defined as a newborn. The study is scientifically appropriate and preclinical and clinical studies have been conducted and provide data for assessing the potential risks to the neonate. And the research provides important biomedical knowledge. The research holds out the prospect of enhancing the probability of survival of the neonate. Both parents are fully informed about the research during the consent process. The researchers will have no part in determining the viability of a neonate. For right to self-determination of child who are up to age 7 years, the DHHS regulations require soliciting the assent of the children and the permission of their parents or guardians. Assent to participate in research means a child's affirmative agreement to participate in research. Permission to participate in research means the agreement of parents or guardian to the participation of their child or ward in research. Research conducted with pregnant women should have the potential to benefit the woman and fetus directly. Researchers need to obtain the consent of the pregnant woman and father. If a person is judged incompetent and incapable of giving consent, the researcher must seek approval from the prospective subject and his or her legally authorized representative. Regarding terminally ill subjects, participating in research may carry increased risks with a minimum or no benefit of terminally ill subjects. Nurses are responsible for ensuring adherence to ethical standards in research as they participate in our institutional review of research and serve as parents advocates in clinical setting. Prison inmates may feel coerced to participate in research because they fear harm or desire the benefit of early release, special treatment, or monetary gain. Some hospitalized patients feel obligated to be research participants because they want to assist a particular nurse or physician with his or her research. In their study report, researchers need to document the rights of patients were protected during the study. The next one is the right to privacy. Privacy is the freedom people have to determine the time, extent, and general circumstances under which their private information will be shared with or withheld from others. Information includes attitude, belief, behaviors, opinions, and records. An invasion of privacy occurs when private information is shared with the person's knowledge or against his or her will. To protect right to privacy, covered entities such as healthcare providers and agencies can allow researchers access to health information if the information has been de-identified. De-identifying health data involves removing the elements that could identify a specific person or the person's relatives, employee, or household members. Also, covered entities may use and disclose a limited data set to a researcher for a study without an individual subject authorization or IRB waiver. Next, we are going to talk about the right to anonymity and confidentiality. Complete anonymity exists when the subject's identity cannot be linked. Researchers know the identity of their subject, and they promise the subject that their identity will be kept from others and that the research data will be kept confidential. Confidentiality is the researcher's self-management of information or data shared by a subject to ensure that the data are kept private from others. A breach of confidentiality can occur when a researcher, by accident or direct action, allows an unauthorized person to gain access to the raw data of study. Special concern can occur in qualitative studies that have few study participants and involve the reporting of long quote made by those participants. In addition, qualitative researchers and participants often have a relationship in which detailed stories of the participants' lives are shared, requiring careful management of study data to ensure confidentiality. The right to fair selection and treatment is based on the ethical principle of justice. According to the principle, people must be treated fairly and receive what they are owed or is comparable to other persons in the same situation. The Nazi medical experiment, Tuskegee syphilis study, Willowbrook study, and Jewish chronic disease hospital study all exemplify unfair subject selection. Another concern with subject selection is that some researchers select subjects because they like them and want them to receive the specific benefits of a study. Random selection can eliminate some of the researchers' biases that may influence subject selection and strengthens the design of the study. The right to protection from discomfort and harm is based on the ethical principle of beneficence, which indicates that one should do good and, above all, do not harm. Discomfort and harm can be physical, emotional, social, or economic, or any combination of these four. There are 5 categories of studies based on levels of discomfort and harm. The first one is no anticipated effect. It indicates that no positive or negative effects are expected for the subject. The next level is temporary discomfort. Studies that cause temporary discomfort are described as minimal risk studies, in which the discomfort is similar to what the subject would encounter in his or her daily life and is temporary, ending with termination of the experiment. Many nursing studies requires the completion of questionnaires or participation interviews, which usually involve minimal risk. In studies that involve unusual level of temporal discomfort. Subjects frequently have discomfort during the study and after they have completed it. For example, subjects may have prolonged muscle weakness, joint pain, and dizziness after participating in a study that required them to be confined to a bed for 7 days to determine the effect of immobility. The next level is risk of permanent damage. In some studies, the possibility exists for subjects to sustain permanent damage. This is more common in biomedical research than in nursing research. For example, new drugs and surgical procedures being tested in medical studies have the potential to cause subject permanent physical damage. The last one is uncertainty of permanent damage. In some research, such as the Nazi medical experiments and the Tuskegee syphilis study, subjects have a certainty of experiencing permanent damage. This is a critical appraisal guideline to examine protection of human rights. The guideline consists of 6 questions, including the right to self-determination, privacy, confidentiality, fair selection and treatment, and protection from discomfort and harm. The guideline will assist you in critically appraising a study to ensure the protection of human rights. Please remember this guideline because you will use this when you appraise studies for the assignment in the class. We're gonna move on to the understanding informed consent. What is informed consent? In Korean, 동의서. Informing is the transmission of essential ideas and contents from the investigator to the prospective subject. Consent is the prospective subject agreement to participate in the study as a subject. Informed consent includes 4 elements. First, disclosure of essential study information to the study participant. 2. Comprehension of this information by the participant. 3. Competence of the participant to give consent. And 4. Voluntary consent of the participant to take part in the study. Essential information for consent are as follows. Introduction of research activities, a statement of the research purpose, selection of research subjects, explanation of procedure, description of risks and discomfort, description of benefits, disclosure of alternatives, assurance of anonymity and confidentiality, offering to answer questions, voluntary participation, opinion to withdraw, and consent to incomplete disclosure. Informed consent implies not only that the researcher has imparted information to the subject, but also that the prospective subject has comprehended that information. The researchers must take the time to teach the subject about the study. The amount of information to be taught depends on the subject knowledge of research and the specific research topic. Autonomous persons who are capable of understanding the benefits and risks of a proposed study are competent to give consent. Oops, I think it's a typo. It's not content, I mean consent. Persons with diminished autonomy because of legal or mental incompetence or confinement to an institution frequently are not legally competent to consent to participate in study. Voluntary consent means that the prospective subject has decided to take part in a study of his or her own volition without coercion or any undue influence. In summary, Researchers obtain voluntary consent after the prospective subject receives the essential information about the study and has demonstrated comprehension of this information. All these elements of informed consent need to be documented in a consent form and discussed in the research report. An example of a consent form is presented in this figure. The bold-faced terms such as research purpose, potential benefits, IRB approval, potential risks, something like that, indicate the essential consent information. This is a sample consent form for children, which is provided from Seoul National University IRB. Also, this is a sample consent form for adults, which also provided from Seoul National University ILB. You can find this document in this website. This is a guideline to examine informed consent. With the guideline for protection human rights, you also remember this guideline for your assignment. Let's move on to the understanding institutional review. In institutional review, a study is examined for ethical concerns by a committee knowledgeable about research and clinical practice. An institutional review board called IRB is a committee that reviews research to ensure that the investigator is conducting the research ethically. Universities, hospitals, corporations, and many managed care centers have IRBs to promote the conduct of ethical research and protect the rights of prospective subjects at their institution. Each ILB has at least 5 members of varying backgrounds to promote complete, scholarly, and fair review of research commonly conducted in an institution. ILBs in hospital often are composed of physicians, nurses, lawyers, scientists, and community laypersons. The functions and operations of an IRB involve the review of research at 3 different levels: exempt from review, expedite review, and complete review. Studies usually are expected from review if they pose no apparent risks for the research subject. A common type of exempt study is when the identified data from patient charts are used. Studies that carry some risks, which are viewed as minimal, quality for an expedite review. Finally, a study that carries greater than minimal risks must receive a complete review by an IRB. A researcher effort needs to identify the IRBs that reviewed and approved a study for implementation clearly. This picture is the review process of Seoul National University IRB. You can also find some level of the reviews. 면제 means exempt from review, but all studies in Seoul National University have to go through complete review. Then the committee member decide that the study is suitable for expedited review. Now we are going to talk about how to examine the benefit-risk ratio of a study. Nurses who serve on an IRB for their agency serve as patient advocates when research is conducted in their agency, or are asked to collect data for a study, should examine the balance of benefits and risks in a study. To determine this balance, or benefit-risk ratio, the benefits and risks associated with the sampling method, consent process, procedures, and potential outcomes of the study are assessed. As you can see in this figure, to develop a study benefit-risk ratio, we need to predict the outcome of the study, especially focus on assessing benefits and risks. When the benefits are greater than or equal to risks, the study will be approved. But the risks outweigh benefits, the study will be rejected. These guidelines can be used to critically appraise the ethical aspect of a study. These guidelines include examination of the benefit-risk ratio of the study, IRB approval, informed consent, and protection of subject human rights. For your assignment in the class, you have to remember this guideline as well. We are going to learn about important terms used in the identification and management of research misconduct. In response to the increasing incidences of scientific misconduct, the federal government developed the Office of Research Integrity in 1989. The ORI was responsible for defining important terms. According to the ORI, research misconduct is defined as the fabrication, falsification, or plagiarism in processing, performing, or reviewing research, or in reporting research results. It does not include honest error or differences in opinion. Fabrication in research is the making up of results or recording or reporting them. Falsification of research is manipulating research materials, equipment, or processes or changing or omitting data or results such that the research is not accurately represented in the research record. Final is plagiarism. Plagiarism is the appropriation of another person's ideas, processes, results, or word without giving appropriate credit, including those obtained through confidential review of others' research proposals and manuscripts. Research misconduct has been reported in the nursing profession. A specific example of a nurse found guilty of research misconduct is Scott Weber, who was found to have plagiarized significant portions of published articles, including using prior studies data in graphs in his publication. He also changed the years of some cited articles in his reference list to avoid detection of plagiarism. Okay, let's move on to the final page for examining the use of animals in research. Animals are important for the conduct of certain studies, and they must be treated humanely during the study. The ethics of studies which use animals as research participants needed to be critically appraised. Currently, at least 5 separate types of regulations, including the federal government, state government, independent accreditation organizations, professional societies, and individual institutions, exist to protect research animals from mistreatment. Today we'll learn about the ethics in nursing research. As mentioned earlier, ethics is a very important part in every research. So you should be aware of the ethical aspect of studies for your own research in near future. Thank you very much.